Hi, I'm Billy Giles. I'm a pediatric otolaryngologist here at the Centa Medical Group. I've been in Columbia now for over 20 years. Today I'd like to talk about pressure equalizing tubes, or PE tubes, or ear tubes. Placement of tubes, particularly in children, is one of the most common procedures performed in the United States. The indications for placement of PE tubes are usually for ear infections or decreased hearing due to fluid behind the eardrum. With regards to ear infections, if a child gets 3 ear infections in a 6-month period of time or 4 ear infections in a 9-month period of time, is usually considered an indication for treatment of ears with PE tubes. The other indication is a 3-month period of time where there's fluid behind the eardrum. There was never a period of time when the ear was normal on exam, and there's decreased hearing in the ears. If there's a unilateral, in other words, just one ear has fluid and has decreased hearing, we would usually wait around 6 months before we would consider placement of PE tubes if all other is normal regarding the child's anatomy. Now, to explain PE tubes, I'd have to do a brief explanation of how our ear works. The way we're made, sound comes in the ear canal, or the hole in our head, and at the end of that hole is our eardrum. The sound makes our eardrum vibrate. That vibration gets sent through the middle ear space, which is the space behind the eardrum, to the cochlea, which is the main hearing organ. The cochlea processes that vibration and sends the message onto the brain. So in order for us to hear, there has to be a space behind the eardrum so the eardrum can move back and forth. And that space has a small little connection down into the back of the nose called the eustachian tube. So the way an ear infection works is the bacteria from the nose comes up that little tube called the eustachian tube up into the middle ear space. The infection then causes inflammation, so the drainage system doesn't work anymore. So the infection is now sequestered behind the eardrum. If you treat it with antibiotics, hopefully it'll kill the bacteria, and it takes a while for the fluid to go away. If the fluid's still there, you have a greater chance of getting an ear infection, and it also decreases the motion of the eardrum, so your hearing is decreased because of the fluid. It's called a conductive hearing loss, so your hearing organ's still working, but the sound just can't get to it because of that fluid behind the eardrum. The way tubes work is tubes go right into the eardrum, so it opens the space behind the eardrum to the outside, out to the ear canal. By doing that, it dries out that space. It also lets the eardrum come back into normal position. The ear is much less likely to get an ear infection because the fluid's out, but if it does get infected while the tube is in, the pus will then come right out through the tube. You'll see it. It's not a mystery. It's not a surprise. It'll just come pouring out. It'll look like you're blowing your nose out of your ear. And what you do is you'll have an antibiotic drop then that you put right into the ear, and so it goes through the tube and treats the infection with a topical drop instead of with something by mouth or by a rocephin shot or an antibiotic shot. Now, tubes are very successful. You have a 1 to 2% chance that when the tube comes out, you'll have a little hole in the eardrum that you'll have to patch up. But that's close to the risk of having a perforation in the eardrum with just the infections alone. About 3 out of 4 times when the tube comes out, the child's bigger, the immune system's stronger, the hygiene's better, and so usually you don't need another set. Occasionally, about 1 in 4 times when the tube comes out, you're right back where you started from with cyclical ear infections, and you need to put the tubes back in. Often at that point in time, they'll also discuss a possible adenoidectomy to clean out the back of the nose, right where the ears drain into the nose. The tubes are very efficacious. They treat ear infections extremely well. They take the pain away. The pressure feeling that the child has is gone, because even if they do get an ear infection, the purulence or the infection comes right out through the tubes. One of the things that the tubes does is it dries out that middle ear space. The eardrum starts moving. The hearing should go up to normal within 3 or 4 days of placement of PE tubes. And that has a very strong positive impact on the child's speech and language development and their brain development.